Maintaining confidentiality of information, one of the principles of care. Just a reminder, what does maintain mean? It means to make sure that you keep confidentiality of the information that you know about service users. Learning outcomes. You need to know what confidentiality is. What does it actually mean? Keeping things private or secret from other people who have no need or right to know. Secondly, when can care workers break confidentiality? What are the circumstances in which they're allowed to do it? Thirdly, why is it important? What effect can it have on service users? And lastly, the practical ways that care workers can maintain confidentiality. We'll look at that in class. It's numbers 1 to 3 you need to know about from this video. So key terms that you'll need to know and understand. What do they mean? Well, first of all, confidentiality. Keeping things secret or private from those who have no right or need to know. A confidentiality policy is a document, a written document that all care settings should have. It outlines what are the rules and regulations around confidentiality, what are care workers expected to do, what are their responsibilities, and what rights do service users have. So what should you do in practice in care settings? Disclose or disclosure means to actually tell somebody else something. So sometimes there are circumstances when you might disclose information to others. You might actually pass that information on. You've just given permission for information about you to be disclosed to us at Franklin College when you applied for your disclosure and barring check from the police in order to be able to go on work experience. The police can disclose to Franklin College anything about your past that says you may not be safe to work in a care setting. And that's a responsibility, something that you will have to do if you go on to work in care settings. You can't do that without having a disclosure and barring check. A code of practice comes out of a policy on confidentiality. Code of practice is what should you actually do or not do in a care setting in order to maintain, in this case, confidentiality. A breach or a break in confidentiality is actually, a break is when you've passed information on to other people. You've broken, breached, or made a break in confidentiality. There are occasions when you're allowed to do that, but in most circumstances, a breach in confidentiality is actually serious, and under the Code of Practice and Confidentiality Policy at work, an employee could be disciplined, possibly even lose a job. You can pass information on to those people who have a right to know because they need to know that information in order to carry out their job. And that without passing on that information, the service user couldn't get the care that they need. Consent. Consent means agreeing to something. You're telling somebody they're allowed to do something. In care settings, we talk about informed consent. So a patient or a service user would be agreeing or allowing you to pass information on to other people, but they know exactly who you're passing it on to and why you're passing it on. So if you go to see a GP and the GP says, I think I need to refer you to the hospital to have this investigated further, he would ask you, is that okay? I'm going to pass you on to the hospital. I need to send them information about you and your condition, and you would know that that was going to happen, and you would give your consent to do so. And in fact, the hospital need to know in order to be able to carry out and give you the correct care. So we pass information on to those who have a need to know and a right to know, and we do it in a way that only those people have that information. A dilemma. A dilemma is another word for a problem. In this case, it's a situation in which a difficult choice has to be made. So, the patient has a right to have information kept confidential, but I'm not sure that this information I should keep confidential. Could it harm the patient if I actually keep it confidential and don't pass it on to others? And if that information means that by keeping it confidential they have a risk of harm, then that's an occasion when you can break confidentiality and pass information on to other people. But it is a bit of a problem. What's the right way to act? Often referred to as an ethical dilemma. But usually, when you're passing that information on, you're acting in the best interest of the service user. You should always act in the best interest of the service user by passing information on or withholding it depending on the circumstances and the information. You also have a duty of care as a care worker to your service user to keep them safe and to act in their best interests. So sometimes that means to keep information confidential, other times it means to actually pass it on. But by maintaining that duty of care and keeping information confidential, you create trust with your service users, and therefore they're more likely to tell you things in the future. Creating trust is a really important part of care work. So what can you pass on to others? You can only pass on information to others if other people who are caring for that patient have this need or right to know. And you can also pass it on when you think that the service user might be at risk of harm. So you can break it then, because the service user has given consent for information to be passed on, like the example I gave you earlier, to a hospital, but without the patient's consent if they tell you that they're going to harm themselves. So, for example, an elderly person might tell you that they're fed up with life, they're fed up with being old, life's not exciting for them anymore, they've no quality of life, they've saved up their sleeping tablets and they're going to put an end to it all. You have a responsibility, to pass that information on. It may be that that service user is actually crying out for help. You also have a responsibility to break confidentiality if the patient tells the carer they're being harmed by somebody else and they don't want you to pass it on. And that could be all sorts of harm or abuse, but you have a responsibility to pass that on. You also have to pass it on if they tell a carer that they intend or have committed a criminal offence against somebody else. It's important that you protect that other people, so you pass that information on. And you pass it on to a line manager, somebody who's responsible for safeguarding the patients or the service users in your care. Somebody usually more senior, a line manager if nobody else, but you wouldn't pass it on to just somebody on the corridor, the first person that you met. You have to think carefully about who you do pass it on to, the person who would take it further. What are the risks to clients when confidentiality is breached? Well, on one hand, sometimes people become at risk or vulnerable from embarrassment or harm or even gossip if other people know sensitive information about them. So things that might be a bit embarrassing, for instance, the conditions that they have or the treatment that they're having. It might also be that they might experience perhaps negative attitudes from other people in the community if people know about their mental conditions. So, for example, somebody with mental health conditions or somebody with a HIV infection, for instance. How might people treat this person if other people know that they have HIV infection? What happens when gossip is passed on to others? Could the information be changed in the telling and being repeated so that actually it's like Chinese whispers? It ends up that the real story or the truth gets lost somewhere in the telling, and people could be harmed by that, if not embarrassed. What about the emotional effects on somebody when information is passed on? The loss of self-esteem, or fear and anxiety if they know that other people know about them, know about their private information. How might they be treated by others? And what about emotional effects on the family or other people in the family? Think about a situation where actually a child might have been adopted or fostered, and the family want that information to be kept confidential. Think about the harm to the children or to siblings in the family if that information has been passed on. Finally, what are the benefits of confidentiality? Because we've talked about the risks of harm, but actually confidentiality is maintained because it's important, because there are benefits to the people who are receiving care if information is kept confidential. So first of all, one of the main benefits, as we said earlier, it actually creates trust. A trusting relationship is formed between client and carer. And that's because if you say you will do something or you will not do something, you will keep this information confidential, and you do so, then clients will trust you. They'll trust that whatever you ask them or tell them, they can trust you again and again and again. So if you build up this trusting relationship, it means that the client's likely to work cooperatively with you. They will trust you, and therefore they'll be a cooperative partner in their care. They'll carry out the things that you ask them to do, and in the future they'll give you other information that might help you give them better care. You know how they're feeling, how things are affecting them. Because they trust you, they'll share more with you, so they benefit. Therefore, they receive the care that they need. Because they keep you informed of changes in their condition, the carer can respond to those changing needs and respond to the care that's given to them. So it might be medication, for instance, or it might be changing the way that care is delivered to them because something isn't perhaps working. So it ends up that the client gets better care if they can trust their care workers. And lastly, and perhaps most importantly, clients have a right to confidentiality, and it's your responsibility as a carer to maintain those rights. It's a fundamental, basic right that information is kept confidential, so you have responsibility to do that day-to-day actions in your work. Just make sure then that you recap on this and you know all the key terms that we went through in an earlier slide and what they mean, how you could use them to answer questions. You understand why keeping confidentiality is important and the benefits to clients of keeping information confidential. And then finally, you know when you're allowed to actually break confidential information and pass it on to others, what are the circumstances in which it's okay for you to breach confidentiality. And what do we mean by that ethical dilemma? How do I act? What do I do? We'll be looking at that again under Principles of Care and under Communication later on in this unit. So make sure you've got a set of notes to bring to lesson about all these issues, and we'll build on them in the next lesson.